Hi everyone, welcome back to Nourish. Today I'm showing you a real clinical case for my own dog Gemma. I've been away in Australia for 3 years, so now I'm going back to take care of them. So today I'm showing you, she has a a form of dermatitis that many owners miss until it's advanced. We'll look at her lesions, explain what they mean, and most importantly, what you should do if you see anything similar. Let's start with her lesions and what I saw on her skin. At first glance, you can clearly see the hair loss and the papular crusty lesions. Her skin is red and irritated because the inflammation is already active. This is one of the earliest signs owners usually miss. Redness plus hair thinning. As you can see, she has hair loss, as I say, papular crusty lesions, redness erythema, and inflammation in lower back near tail. Dermatitis in dogs is always a trigger. Parasites, allergies, infections, or environmental factors. In Gemma's case, it looked very similar to flea allergy, dermatitis. But remember, we cannot confirm the cause without proper tests. The appearance helps, but it never gives the full story. In this part of the video, we're showing hair becoming thinner, dark red black crusts, more evident hair loss. As the video continues, her hair becomes much thinner, and the dark red or almost black crusts begin to form. These are signs that the dermatitis has been going on for a while. Chronic inflammation changes both the hair and the skin structure. When dermatitis progresses, we start seeing chronic damage. This is why early treatment is so important. Waiting makes everything harder to control. In this part, we're showing tail base, thickened skin, white crusts, and early fungal changes. When Gemma lifts her tail, you can see a different type of skin entirely. It's thickened, rough, and covered with white crusts. This happens when the dermatitis becomes chronic, and in her case, it's almost at the point of a fungal infection. When we see thick, elephant-like skin with crusts, it means this didn't start yesterday. This is months of leaking, irritation, scratching, and inflammation. And dogs rarely complain, so owners don't realize how bad it is. In this part of the video, you'll see back again body standing, vulva area, purple color, thick skin, transition to ear thick, red and white crusts, other ear less effect, front legs normal, the knee, flank, mid-thigh, reddish irritated. As we move from her tail back to her spine, you'll notice how the color changes. Around the vulva, the skin is purple and very thick, This level of discoloration is a sign of chronic inflammation. Her ear also shows the effects of dermatitis, thickened skin, redness, and white crusts. The other ear is less affected, which is common. Dermatitis is rarely perfectly symmetrical. On her front legs, there's nothing significant, but on the knee and the flank, you can see the areas she bites, leaving reddish, irritated skin. Dermatitis spread. It rarely stays in one spot, and every dog reacts differently. Some develop ear problems, others get hot spots, and others get fungal infections. This is why you must check the entire body, not only the area you see first. At the end, you'll see vulva, belly, and ears. At the end of the video, you can see the belly area and the ears again. These are areas where moisture and bacteria can accumulate, making dermatitis worse. So, what do you do if your dog looks anything like this? First, visit your veterinarian, of course. Second, treat underlying causes like parasites, inflammation, or allergies. And third, follow a consistent skincare routine. I have more videos on ear infection, skincare routines, and how to clean your dog properly, which I'll link below. I also had a Gemma taking a bath, and I'll show you in the next videos as well, following up this. So thanks for watching, and send a hug for Gemma. And I see you in the next vet Nourish case.